Welcome back, everybody. It's time for our third segment here on Ask the Expert. Diana Murphy is here, and we've got some great questions. We'll start with Edith, who's on the telephone. Edith, how are you?
Great.
Very good. What's your question today?
Well, my question is, I had the vein treatment before, and I had it done with salt and water. Now, I'm just wondering what the difference is between the salt and water and the laser, and how does that work?
That's a good question, Edith. Now, what's this salt and water she's talking about?
Probably needles, right, Edith? You had the needles?
Yeah? Is it needles? Okay, Edith's gone. Yeah.
Okay, the salt, what she's talking about is sclerotherapy. So the difference between sclerotherapy and what I do, basically the end result is the same in the sense that what the needle does with the solution is it basically, you inject the solution, it damages the wall of the vessel collapses, your body absorbs it.
Right.
The vein's gone.
Right.
When I use the laser, the heat goes in, damages the vessels, cut off the circulation to that vessel. The blood goes deeper down where it's supposed to be.
Right.
That vessel wall collapses and your body has to absorb it.
Right.
Okay?
Right, so that's how the vein disappears.
That's how the vein disappears.
Okay.
Now, what she's asking me is whether one treatment's better than the other. Well, it depends on the size of the vessel and everything else. So if you're talking about varicosities, definitely sclerotherapy is better for you.
Okay, yeah.
Okay?
Yeah.
But you can go get those treated and then come and get me to do the superficial vessels.
Gotcha.
Okay? When you're talking about teeny tiny little vessels, the spider veins that are on your legs, they respond, from what my clients tell me, much better than the sclerotherapy because it's faster and it just seemed to go away. When some of my clients have been saying they've gone for sclerotherapy treatment and over time they keep going and the treatments either tend to, some areas tend to cause matting, which is little tiny vessels at the site where you've injected.
Okay.
So which can cause, well, I can get those, that's pretty easy for me. It's not easy for a needle because your needle, you're injecting fluid, so you're causing a little bit more trauma to that area. So it can precipitate more vessels.
Interesting.
I don't seem to have that issue with precipitating more vessels with my laser. So that's the difference, that's the answer to her question.
Very good. We've got Terry on the telephone with another question along those lines, I do believe. Hi, Terry, how are you?
Hi, very good, thanks.
Very good. What's your question today?
Okay, my question is about rosacea in the face. I've been diagnosed with the rosacea, and I've been doing some research. And rosacea message boards were saying that both Z-beam and photo rejuvenation require, for them to work, they require that the technician take it up so high that you get quite a bit of bruising, and that's the only way that it's going to be effective.
Right.
If they don't, you'll just never get it to go away.
So you're wondering about the bruising then?
Yeah, and if it's required.
No, actually, it's not required. I've treated a lot of people with rosacea. That used to be old school. They used the V-beam does bruise, and you're out of commission for a couple of weeks. In my office, what I do is I go after the vessels that you can probably see on your face. I don't know if you can see any vessels.
Right.
I knock those off first, and then I go after the underlying redness with an IPL treatment, and I hit you fairly hard. I have not gotten, if I've gotten any bruising, it's been very minor, and it's not very often.
Right.
Now, that being said, rosacea, you can't cure rosacea. We can get it under control, but there's no cure for it.
No.
You can get it under control. I have clients that have really bad rosacea. After a few treatments coming in to see me, I might see them once a year, once every 2 years. With really, really bad rosacea, I might see them every 6 months for a quick IPL.
Right.
So, these clients are very well managed. So no, you do not have to go through the bruising. That's old school.
Gotcha. Well, it's a good question to ask.
It is a very good question.
It was, in fact, common practice.
Well, I've gotten a lot of people in my office that have gone through that procedure in the past at different places. When, in the past, that was all that was available.
Right.
And they brought pictures of them. And it looks like someone took a baseball bat, hit them across here, and they were just black and blue. And they didn't know that was going to happen. And 2 weeks out of work is, it's a lot for a lot of people.
We do have time for one more question. Patty's joining us this morning. Hi, Patty. How are you?
Very good. How are you this morning?
Very good, thanks. What's your question?
My husband was just diagnosed or whatever with rosacea, and he has a beard.
Yeah.
And it's just on his cheeks. He looks like he's happy all the time.
Yeah.
He opted using cream to get rid of it. He's nervous with the laser because of scarring. He's worried because it's on his face. Everybody sees it every day. So he's more concerned as if the laser does, and we've all seen those W5 laser scare. So I guess being on his face, he's more scared of having the laser. Is it something he should be scared of?
Well, you should be very cautious about where you go and what their track record is.
Right.
I've never scarred anybody or burnt anybody on their face
this is your
like
field,
that.
right,
So
Diana? This is what you do.
And, you know, when you're dealing with a man and on his cheeks and when he's got a beard, you have to be very cautious because the beard has pigment in it. This is a pigment-seeking device. So the man has to be warned that he could lose some of his beard.
All right. Should you shave it off? Would that help?
Well, he'd have to shave it off if I was going to go into that area. Sometimes the rosacea is just kind of concentrated on the cheek area where the beard isn't.
Right.
But if it's lower and it bothers him in that area, losing facial hair is a risk. Especially if he's very dark pigmented hair. So yeah, risk. It's always a risk whenever you're putting a heat source near anybody.
However,
you have to, but you have to go somewhere where it's reputable and you know, and make sure you do your research.
That's a good idea. And next time you're on, we'll talk more about some of the other things that you can do for people. And I know that the list is extensive.
Yeah, we do a lot of nice things. It's the best job.
Exactly.
Yeah.
Murphy Laser joining us. Diana Murphy, thank you so much. Good to see you, and I'll see you next time you're here.
Okay.
If you want to get in touch with them, listen, do yourself a favor. Like Diana said, do your research. And you can do that by talking to the folks at Murphy Laser, going on their website, and finding out more about the services you might want for yourself or someone you know. Coming up on 9:38, CTV Morning Live continues right after a quick break. We'll be right back.